everyone, and welcome to another episode of Health and Wellness. My name is Tristan Richards, and I will be giving you some tips and tricks on how to keep that beautiful smile. This is for someone who is brushing and seeing that red stuff in the sink and thinking, I'm brushing too hard. No, you are not. Bleeding gums is something that is very common in a lot of persons, and I want to tell you today, bleeding gums are not normal. Your gums are not supposed to bleed. Now, I'm going to be talking about several reasons that your gums might be bleeding. The first one, the obvious, you have gum disease, and I'm going to explore a bit more of what that entails. But your bleeding gums could be caused by gum disease, hormonal problems, cancer, certain medications, and of course, if you're really brushing hard. Now, this is like at the bottom of the bottom, because even when you're brushing hard, you will not see that significant amount of bleeding. All right. So into the first reason why your gums bleed: gingivitis, gum disease, periodontitis. This is caused by whenever we have a lot of plaque and bacteria and tartar around your gums for an extended period of time. So gingivitis is inflammation of the gums. Gingiva is gums. Itis is inflammation. So it simply means inflammation of the gums. As a child growing up, when I heard about gingivitis, I thought, oh my God, all my teeth are gonna fall out, right? But it's really just simply inflammation of the gums. And oftentimes this inflammation is caused by things such as bacteria and plaque just sitting around the gums for an extended period of time. What happens is that the body tries to remove this bacteria for you because it's been telling you how long. It's been giving you those subtle signals. So it starts with a little swelling, a little bleeding, a little inflammation, and you've been ignoring it. So the body's, in a sense, is trying to remove that plaque and bacteria for you, and that is why your gums are bleeding. It releases inflammatory mediators, and that's why you get the puffiness, the pain. Maybe when you floss, it's a little painful, it's a little uncomfortable. When you floss, it bleeds. This means that you have, or 90% of the time, you do have gingivitis. Now, what I find and what tends to happen, most persons ignore this, okay? And especially if you did not come in for a cleaning, this will then progress to a more severe type of gum disease, which is periodontitis. Periodontitis is when the inflammation now spreads from the gums and the surrounding and the attachment of the tissues to the bone that surrounds the teeth. And the scenario I often use with my patients is, have you ever seen someone where their teeth look like sticks in their mouth, or they look long and they're sticking out? That is someone with periodontitis. What happened is that over the years, they've left that buildup around their teeth, and then eventually the gums start to go down, like our little friend here, right? Eventually the gums start to go down. Eventually, the bone also starts to go down. In a healthy mouth, the bone is supposed to go up and around each teeth. But as we can see, even in this model, the bone is all the way down. So, and another thing, just now as I have this model here, oftentimes whilst this recession is happening, you start to see a bit of yellowness around the gums. And my patients would come to me and say, okay, I want to whiten my teeth because it's yellow. But as you can see, naturally, the roots of the tooth are a yellow color. So it's not that your teeth are stained. It's not that you need to whiten them. It just means you're experiencing a bit of recession around the gums. And as such, it's showing the yellow root surfaces. Another thing that tends to happen is that you may have periodontitis. You may have severe gum disease and you don't know. Because the gums are all the way up, everything looks healthy, right? But let's take a look at what is happening here with our little friend. Even though his gums are all the way up, if I should pull back the gums, we could see that the bone has gone all the way up to the top, and we could see that there's quite a bit of buildup in the area. Now, this is one of the most important reasons why you have to get a professional dental cleaning. Because even if you brush in like a superstar, you cannot brush below your gums, no matter how hard you try. And oftentimes, that is where a lot of buildup is being hoarded. And you need to have a professional cleaning to be able to remove all that buildup. So, if you notice that you have bleeding gums, don't sit and say, oh, yes, I'm brushing too hard. Oh, it's because I'm flossing. Because persons will tell me they stop flossing because their gums bleed. But the truth is, your gums are bleeding because you don't floss regularly and because you need a dental cleaning. And don't go out watching those YouTube videos telling you how to stop your gums from bleeding. No. Come in, go see your dentist or your dental hygienist and get a thorough cleaning. And I guarantee you that you will see significant reduction, if not complete season of the bleeding of your gums. So thank you again for joining us for another health and wellness. I will see you next week when I will give you some more tips and advice on how to brush and keep that wonderful smile.